Awesome. Well, hey guys, I am Sarah Brickelman, and I was in a group with Austin and Nolan. The topic we chose was iron deficiency anemia. Iron deficiency anemia is a condition where you have not enough iron to produce enough healthy red blood cells to carry oxygen to your body's tissues. And so in simpler terms, it's just an iron deficiency, as the name suggests. Iron deficiency, there are many other types of anemia, including vitamin deficiency anemia, sickle cell anemia, which you guys may be familiar with, hemolytic anemia, aplastic anemia, and bone marrow associated anemia. But I'll just be discussing iron deficiency anemia since it is the most common, and because I just have a limited amount of time. So on the screen, you can see a picture of a healthy red blood cell. Iron is very important in the formation of RBCs. Every RBC in our body carries hemoglobin protein, which is responsible for carrying oxygen that our bodies need. However, it requires iron. So that little iron complex called heme. And if there is no iron, there is no hemoglobin. And without hemoglobin, our bodies can't transport oxygen to our body's tissues, which isn't a very good thing. So, causes. Why do people become anemic? One of the reasons could be something as simple as a lack of iron in your diet. However, there are some instances where your body has an inability to absorb the iron that you're consuming. And this could be due to a number of gastrointestinal reasons or abnormalities. And it could also be caused by lack of vitamin C or B12, which is a vitamin that is really important for helping your body absorb iron. Iron deficiency anemia is most common among females, as some women are prone to experiencing heavy menstrual periods during which they lose lots of blood. Pregnant women are also high risk because their iron stores are spent on increasing their blood capacity for the growing fetus. Babies, and especially those born prematurely, are sometimes likely to become anemic as well, as they are often underweight and don't have quite enough blood to provide for their bodies yet. That, or they don't receive enough iron from their mother's breast milk. So as you can see, iron deficiency affects a lot of wide variety of ages. However, it is most common in women and infants. So if your body is not getting enough oxygen, you can imagine that it would become very tired and weak over time. Breathing rate may also be elevated as your body's way of trying to compensate for that lack of oxygen. Dizzy spells, chest pain, cold hands and feet, or headaches are all symptoms of someone who may be anemic. All these symptoms are quite typical for a wide variety of illnesses, so it's really hard to tell if someone is anemic or not unless you do a blood test. I will make a special note about jaundice or yellow skin. It is very common in newborn babies, and it's an indication of your red blood cells dying, and as a result, releasing this stuff called bilirubin, which is this yellow pigment. And it's typically associated with some sort of liver malfunction because it's the liver's job to filter out that bilirubin. So at first, symptoms may be unnoticeable or very, very mild, but as anemia worsens, so will the symptoms. So what can be done to test if someone has iron deficiency anemia or not? Well, the first thing is a medical and family history exam, and what they're looking for is if the patient has any history of, or anyone in their family that has underlying diseases. A physical exam will be done to check for symptoms that might indicate if someone has anemia or not and how severe it is. And also a complete blood test will be run, particularly focusing on hematocrit and hemoglobin levels. These levels range between men and women, and also pregnant women and infants. So a hematocrit level less than 40% for men, 35% for women would be concerning, as well as hemoglobin levels less than 14 grams per deciliter for men and 12 for women. Lastly, doctors may run a test that checks for the size, shape, and color of red blood cells. And what they're looking for is a paleness in the cell, and that's an indication of low hemoglobin levels. Treatment. Treatment varies on the severity. In mild cases, something as simple as a change in diet could be all that is needed to correct the anemia. So eating really iron-rich foods listed on the screen. Also increasing your vitamin C intake. As I said before, vitamin C is really good for iron absorption in your body. For medium cases, your doctor may prescribe iron and vitamin C supplements, which are just tablets that you take orally. And for women, they may suggest birth control to regulate menstrual flow and to limit that blood loss during that time of the month. And in very severe cases, an IV may be needed to inject iron straight into your bloodstream or a blood transfusion. So short-term prognosis for most patients is very, very good since most cases are not very severe. However, chronic iron deficiency can lead to death if there's an underlying cause such as bone marrow cancer, autoimmune diseases, or some type of lung or heart disorders. And that's it.